While COVID cases continue to mount at record levels, hospitals are still caring for critical patients and are now preparing for more. Tonight, we take you inside and show you the experiences of doctors, nurses, and those living with the virus firsthand. The flurry of activity offers a glimpse of the daily struggle with COVID on the front lines. Here in the intensive care unit at Humber River Hospital.
619, reporting a new patient, and that patient's got a lot going on.
While assessing the day ahead, any moment there could be a turn for the worse. They managed the first wave of the virus hitting hard in the spring, desperately trying to figure out how to care for those infected. Now, Dr. Sanjay Manocha says it's about preparing for what they know is coming again.
The worry is that in the coming weeks, that could have a significant impact on capacity within the hospital, the emergency department, and in fact our ICU as well.
And then what happens at that point?
Well, at that point, we still have to care for them and we have to support them as best we can.
This yellow dot right here represents a patient in this room who's either COVID positive or suspected COVID. At this point, there are 9 people in ICU, 6 of which are on ventilators, including this patient, 45 years old, who came in last night.
Put the Versed down to 10. Came in profoundly short of breath with high oxygen requirements and rapidly deteriorated, requiring intubation and ventilation.
No known previous medical issues, now heavily sedated and struggling. It's the worst of what's now being experienced as the second wave hits.
The patients are much younger, like 40, 50, 60 age group, and they tend to be managed more on the OptiFlow versus going right through to the ventilation procedure.
On a different floor,
hi there.
Heather Jordan sits by, still recovering from her experience of not being able to move and needing oxygen for days.
The nausea is really bad. My body was aching all over like a truck hit me. That's how it felt. I still feel a little bit of the symptoms still, but not like it was when I first came here. 10
pounds lost over 2 weeks. Too dehydrated, they run a line for blood while she still struggles to eat.
What would you say to people who haven't experienced this or know anybody who has?
I would tell people to take this more serious because this isn't a joke. When you get these aches and pains so bad, like you're being hit by a truck, it's a horrible, horrible feeling. I don't want to see everybody else suffer the way I've suffered from it.
What do you know now and how do you prepare for what's to come?
Well, part of it is in terms of how to manage them when they come here, at least in the ICU, but even when they come onto the medical floor.
Staff here at Humber River and elsewhere have learned to better handle COVID with new treatment strategies, but there's only so much that can be done before more patients arrive. While the ICU capacity levels are still below the targets set out by public health officials, it's the acute care beds that are the immediate concern. According to data released by Toronto Public Health, it sits at around 90%, dangerously close to where hospitals will start having problems.